In fact, if the human brain were actually developed to the size that it would be able to be like the gazelle or the antelope or the elk, that within 45 minutes of being dropped on the ground can run at full speed, our heads would be 8 times as large as they actually are. Okay? Sorry, moms. Thank goodness they aren't. And thank goodness that child is dependent upon us for a few years while they're actually developing that cranium. Okay? But think about it. When you think about that little child when they're born, how that little softball melon head actually grows, and by the time they're that 1-year-old, how much larger it's getting as they become more and more coordinated. By age 2, how much larger. Okay? So big brain really works then based off of a braking mechanism. And coordination of movement is taking off the brakes and reapplying them. Okay? So it's inhibition is the phrase that we use. And a loss of inhibition or escaping is then what we start to see in a lot of these movement disorders, and then some of these escapes that we start to see when we look to the left brain of Tourette's syndromes and the inability to read despite a normal IQ and equal education opportunity called dyslexia. Okay? That becomes then left brain. So still focusing then right brain, if the brakes are not applied, we start to see these escapes. Now, if this right brain is slowed in its activity, its coordinating opposite cerebellum will also be slowed in its coordinating activity. So we look at this left cerebellum actually feeds forward information to the right hemisphere, and will just give simply a left cerebellum, right hemisphere model tonight to keep it simple. Okay? The left cerebellum will coordinate the eyes to the right, down and to the right, and up and to the left. Now this is advanced neurology for everyone, okay? Including all the neurologists. But I'll teach it to you tonight so you can see something that's really important. When we look then at the opposite is true because the right cerebellum, because it's yoked to the left hemisphere, we actually see the right cerebellum, therefore, is extremely active. And what we'll see is because the right cerebellum is moving the eyes in the opposite direction very, very strongly, the eyes, in order to go down and to the left or to the left, will actually, if I move my head to the right and keep my eyes in that focus, you'll actually see then that what the child will have is this type of a head posture. Okay? So their right cerebellum is dominant, their left hemisphere is dominant, and they'll have a head posturing that is turned to the right. Okay? Look for the pictures. There was a Time magazine article given, and on the front is autism, and it has a child who's autistic. And if you look, he's classic. This is his head posture. Okay? His head is turned to his right because his eyes are to the left and down and to the left. This is his perception of the world because it's so much more dominant. Okay? Pretty fascinating, isn't it? When you actually look at how strongly and how connected the brain is. So he is completely using the dominance that he has, and it's just like the hand of dominance, to the point where he almost has a neglect of the opposite side. Okay? So the treatment then becomes very realistic and simple in that if this is my dominance, what am I going to do to create equality in the non-dominance? Activate the opposite side, right? So that's exactly what we're going to do, and I'll talk about that tonight. But that's exactly what we'll see. We'll see a right head rotation, head carriage. Okay? And when you start to see it, you'll be like, oh my goodness, I see that now. Okay? There are going to be little kids that you're going to see when you go to the elementary school. You're going to see them going about. You'll see them kind of escaping, not understanding, whatever the case may be. And you look closely, and you're going to see they're going to have this little right head rotation. Okay? And again, for those of you who are coming in now, I'm normally when I communicate or I'm speaking, again, you'll see that I kind of do my dancer's left, right? Let's all go to the left, let's all go to the right, which of course is a mirrored reflection of you. Tonight I'm actually speaking so that you're seeing it in the perspective as the child would be as you're observing the child. Okay? It is their reality, it's their right. It's not a mirror. Okay? So that's what we'll see with this child, which again, very, very fascinating. Now, we had spoken earlier about Dr. Krasian's work. I want to reference again Dr. Krasian and some of the things that he's showing with autism, this autoimmunity, and turning on some of these genes that then cause this slowing, metabolic delay in the right hemisphere, and a couple of the other things associated with that. He actually says, on pages 63 and 64 again of his book, a recent study, for instance, looked at the impact of dental amalgams on Hashimoto's disease. So we're talking about autoimmune thyroid, which we had drawn earlier and erased already. In people having an immune response to mercury, the researchers concluded that the removal of mercury-containing dental amalgams contributed to the successful management of those with thyroid disorder. That's fair. In other cases, however, liberating stored mercury with methods like chelation can exacerbate an autoimmune response. A good example involves autism. Many doctors peg autism on heavy metal toxicity and prescribe chelation. I, Dr. Krasian, on the other hand, think that an immune response to mercury can trigger an autoimmune attack on nerve or brain tissue causing autism. Chelation releases stored mercury into the system and can exacerbate an autoimmune autistic condition, causing more tissue death and a worsening of symptoms. In this situation, the most important action is to restore integrity to the immune barriers. See my protocol for repairing leaky gut in Chapter 6, especially if immunoglobulin M, or IgM antibodies, are elevated. This prevents mercury from slipping into places it doesn't belong, like brain and nerve tissue. In addition to supplying the right nutrients to restore these barriers, remember that stress significantly weakens these tissues. Since poor blood sugar handling is a top stressor, balancing blood sugar is key. When restoring integrity to the immune barriers has resulted in successful dampening of the autoimmune condition, chelation may be appropriate with careful monitoring, but perhaps not. It is better to live in peace with mercury than permanently destroy brain tissue in an attempt to eliminate it. In other words, a lot of people then will say, oh, autism, heavy metal, chelate. And they'll give sodium EDTA, they'll actually do a chelation and try to pull out the heavy metals. But the big problem is that within our adipose tissues may be stored these heavy metals. And when we just release or push, oftentimes these escaping heavy metals then, once they get back into the bloodstream and the body's tried to store them, their first place then to re-find residency is no longer where the body has stored them, but in this brain that is 70% fat. Okay? That's our problem. And in the past, again, if I treated the same way I used to treat, I'd have to punch myself in the face. Right, Dr. Robertson? We don't continue to treat the way we used to treat. We've learned too much. So we don't do those types of heavy metal pushes anymore. If we get our amalgams treated, we don't just go in and say, oh yeah, sure, let's just drill those things out and vaporize that amalgam because I heard I should release it. This is a lady that came to us that she had heard, I need my amalgams removed, went in and the dentist said, yeah, I can remove all your amalgams in one weekend. So she went 4 hours north from where she lived, had the dentist take out all of her amalgams, and for the next 6 months was living with a migraine constantly and could not find her way. She's just blown out of the water because they had just dusted all of this stuff. Okay? When you look at it, again, mercury, where are the only places that you can legally get rid of mercury? If you break a mercury thermometer, if you have a scientific accident If you have a mercury toxicity, where can you legally get rid of mercury? Through a hazmat cleanup team, right?
Or
In a silo or in children's teeth, in the human mouth, right? In veterinary medicine, it is illegal to have any mercury-containing supplements, nutrition, or dental work done. It's illegal to put it in your dog's mouth. Did you know that? And yet, we see these kids with autism smile, and they've got a face full of silver.
Are they still putting them out there?
Yes.
Yeah.
In the house?
50%.
Really?
Yeah, 50%.
Yeah.
Wow.
And it's all that the government pays for on Medicaid.
Correct. Okay. So that's a whole nother can of, it's bigger than worms. Okay. That's it. That's like going into the religion and political science discussion. We're not going to go there tonight.
That's next week.
That's next week, exactly. And that's in closed quarters for only those invited and welcome who believe what I believe. Okay?
And no videos.
Exactly. And no videos, thank you. So this really then becomes so much the argument. Now, let's also look at one more key to this. Brain. Okay? Does my child have an autoimmunity, or does my child have multiple food sensitivities because of this leaky gut presentation, because that's what's causing their autism, and because I changed their diet, they're doing so much better? Is that really why? Remember, the right brain controls upper GI function. Okay? The left brain controls lower GI function. The left brain activates immune system. The right brain suppresses it. So if the left brain is very, very dominant, and my immune system is getting more and more robust, and he's just looking for a marauder, someone to fight. Imagine then, as this gut becomes more and more permeable, then many foods, proteins start to pass through this gut, and now I have multiple food allergies because my robust left brain immune system activator is saying, bad guy, bad guy, bad guy, bad guy, bad guy, bad guy, bad guy. And all of a sudden everything looks very, very bad. Okay? And that's that autoimmunity, again, getting more and more ramped up. The other thing that we'll see, though, is because the right brain is so slowed, then it doesn't put the brakes on the bad guy, but it also then causes upper GI dysregulation. So if you see in the child, remember, the older child will have this type of a head carriage. What will the infant have if the head is always turned to their right and they're lying on their back?
Flat head.
Flattened head, but more importantly, where will their bald spot be?
Right there.
On the right side of their head. Okay? It won't be in the center. How many of you have held a little infant and you've seen that bald spot off center? Completely off to one side. If you haven't seen it, you aren't holding enough infants. Okay? So, here's what you'll see with that child. When the child goes to tummy time, when you put them on their tummy, what will they do? They'll roll only to their right. And then they'll lay on their right. You'll turn them back over their tummy, and they'll roll to their right again. Okay? And this child will have a big, big problem with constipation. This child often will have difficulty with burping up, spitting up. Okay? And so what have we given now? We have this wonderful thing called spit up reducing formula. Right? Mm-hmm. And they also give the child Nexium or Prilosec or something to keep them from getting so much acid. Right? So now we have babies on an acid blocker inhibiting their intrinsic factor release, inhibiting their ability to absorb B12, with an immune system that's marauding and patrolling for everything as a pathogen, but now has this heavy metal toxicity and can't have enough gut barrier balance, so the body allows then a concomitant yeast infection overgrowth. So now on his skin, we start to see the eczematous or eczema at the elbows, the patches on the elbows, and the wrists, the backs of the knees, and the tops of the feet. Okay? And you'll see it again and again and again. But all of these things come back to this pattern right here. Isn't that amazing? When you actually start to connect the dots, it's like, wow, that is really neat for me, okay? When I first started to see this, all of a sudden, all of these little dots that we were chasing, all of these little things that we were looking for, and all of these little things that we were treating started to make sense, and we start to see then all of these things that are pointing in these different directions are really just pointing back. It's a brain problem. This is a major, major, major brain problem. And when we can fix the brain, then we can fix the body. Okay? So no wonder there's the Dr. Amen who says, what's the one book that was the bestseller? Fix Your Brain, Fix Your Life. Did you see that one? Okay. Dr. Amen has, he's a phenomenal doctor in his ability to look at a diagnostic scan of the brain and be able to show where the imbalances are. When we look at this type of a presentation though, and we actually start to put it back together, we can see that there is a lot of tone for brain. It's a good thing that's not